I've had the pleasure of attending a couple of conferences where the VA's whole health system, an overview of the VA's whole health system was presented, and caused me to think that this would be an excellent topic for the working groups to be exposed to. And also had the pleasure of visiting a couple of VA centers and seeing the actual work on the ground that's happening both in Fargo, North Dakota, and here in Minneapolis at the VA Center's whole health systems. And it's just very, very impressive work by some very dedicated individuals. So we're thrilled to have that just that broader overview shared with the working groups and others that might be on the call today. So with that, I'll get to our intro of our presenters today. Kavita Reddy is an emergency medicine and integrative medicine physician at the VA St. Louis Healthcare System in Missouri. She serves as the Whole Health System Director in addition to her clinical duties. She's an assistant professor in emergency medicine at the Washington University School of Medicine. She's been working closely with the Veterans Health Administration's Office of Patient-Centered Care and Cultural Transformation, OPCC and CT, as a clinical champion since 2011, and currently is the lead clinical champion for the Integrative Health Coordinating Center under the OPCC and CT. Our next presenter is Lori Phillips. Lori works virtually from Big Spring, Texas, and brings over 22 years of healthcare leadership experience to her role as the Associate Director of the Whole Health Implementation for the Veterans Health Administration's Office of Patient-Centered Care and Cultural Transformation. Lori joined the VA in 2001 and the OPCC and CT in 2011. Prior to her role there, she served as the Chief of Nutrition and Food Services at the West Texas VA Health System, or Healthcare System. Lori is a registered dietitian and nutritionist and has extensive clinical and hospital operations experience in both VHA and the private sector. She's a graduate of VHA's Executive Career Field Program and a certified mentor. During her career, Lori has successfully implemented a variety of patient-centered care initiatives at the local Veterans Integrative Services Network level and the national level. She is honored to serve veterans on a broad scale and partner with VA facilities to develop cultural change strategies in support of the VHA's vision of patient-centered care. Lori's married and has 2 daughters, and they enjoy traveling, being outdoors, and anything sports-related. So with that, it's my great pleasure to introduce both Lori and Kavita and turn the presentation over to them.
All right, thank you. Let me just check in. This is Laurie. Can you hear me okay?
I can hear you.
You sound great. Thank you.
Sounds good. Yeah.
Okay, perfect. Well, if you'll go to the next slide really quickly, you can see who you're speaking with there. A great professional picture of Kavita and a not so professional picture of myself. But if you'll go to the next slide, then we'll start in with the overview. What we thought we would do today is talk to you a bit about what the VA is up to regarding healthcare transformation, talk about what whole health is, how we're working to operationalize it, and then also talk a bit about our Integrative Health Coordinating Center, and then the activities there, and hopefully answer any questions you have. And so I'm going to start. And just for a bit of context, I wanted to talk about the Department of Veterans Affairs. So the department, who we have a cabinet level position in the administration. There's a Secretary of Veterans Affairs. But the department has 3 administrations that fall under it. VHA, Veterans Healthcare Administration, is the largest of the 3, but there's also the VBA, Veterans Benefits Administration, and then the NCA, the National Cemetery Administration. So you'll hear us talk about VHA, Veterans Health Administration. That's the big umbrella that Kavita and I fall under, but also the big VA some in this presentation. So VHA, Veterans Health Administration, really is undertaking one of the most significant changes in the philosophy and practice of healthcare ever embarked on by an organized healthcare system. If you're not aware, VHA is the largest integrated healthcare system in the country, and we sometimes are maligned in the media, and we have had challenges with access. But we are really broadly recognized for the high quality of the healthcare that we provide. I've worked in both private sector and VA, and I think there's just really fine care that goes on in the system. But no matter whether you work in VA or private sector, I know you're all aware of the healthcare crisis that our country is facing. The United States has high costs that continue to rise exponentially, and really poor outcomes despite those expenditures, particularly in areas of chronic disease. And veterans, just as normal citizens, have an increasing number of chronic conditions. And in addition to that, when they are returning from their active duty, they're often faced with serious and complex service-related injuries. So there's really a driver, an impetus for us to redesign how we think about healthcare in order to address this. And so we're doing this by focusing on shifting from a problem-based disease care system, a find-it, fix-it type system, to one that's more person-centered. Next slide, please. So the way that we are doing this, that we've envisioned this, is through a whole health approach. And what does that mean? So for us, whole health is an approach to healthcare that empowers and equips people to take charge of their health and well-being and live their life to the fullest. So at its core, that's what we're up to with our whole health approach. And I always like to put that up next to the VHA mission statement, which is to honor America's veterans by providing exceptional health care that improves their health and well-being. I think that's just wonderful that our mission statement includes includes and differentiates really between health and well-being. Next slide, please. Some of the core concepts related to this whole health approach are listed here. One being holism, really looking at this as a systems approach versus just a reductionistic approach. So all aspects of our health are interconnected. Everything about you impacts your health. And I know that these core concepts will resonate with you all. Self-healing, really, we all possess the innate capacity to heal, and there are approaches that can strengthen or weaken that capacity to heal and to be healthy. And then finally, mindfulness or mindful awareness, and that's really learning how to pay more attention to the body and allowing you, a person, to make better decisions in their health care. Next slide. So if we really embody this whole health approach and these core concepts, what we hope to achieve is here in this will be column. So you can see the as is, and these will probably sound very familiar to you as they describe the system in which we provide care right now. It tends to be very problem-based. Processes are often physician-directed, disease-focused, find it, fix it, very reactive to an acute care in the moment. And these things, being able to find things and fix it and be reactive in the moment are extremely important. And we know that this has not been successful overall, again, in improving our health and well-being. So what we hope to transform to and what we're working to transform to is a system that's more person-focused, that partners with the person over time, and that we really look at health optimization, not just finding and fixing, but hopefully preventing some of those chronic conditions, looking more at whole person approaches and really focusing on skill building and support. And then on the next slide, so those are all just kind of context and concepts. And then this particular graphic I'm going to talk through for a little bit because this really explains to you how we're working as a system to operationalize these concepts. So this is what we call our whole health system. And you can see it has three sort of central components in the pathway, whole health clinical care, well-being programs that's kind of overlaid with a personal health plan, and then all set in the context of healing environments, healing relationships, and then a community. And so let me just talk you through some of this and how we're systemizing this. So traditionally, traditionally healthcare focuses solely pretty much on this whole health clinical care area. And again, that's important, and it still remains important, but as you can see in this system, it is one piece of a bigger puzzle. So we are working really on transforming to a more comprehensive system that allows us to engage with patients and empower them to discover what's important to them in their life and what they might want to work on as part of a personal health plan. And so this process we've found is most successfully done in this pathway section, the section that talks about empowering. So in practice, what we do there is really partner with the veteran, the person, and their family of choice, if they so choose, and help them to explore their mission, their purpose, their aspirations in life. What do they really want their health for? And so we begin to ask them sort of reflective questions, and they can begin to think about, what does matter to me? Why do I want to be healthy? What are some areas that I might want to work on? And what we've learned as we've been working on this model for the past several years is that this particular process is best done, most successfully done outside of the clinical encounter, done with a peer, either a veteran peer or a non-clinician, to really just help with that self-exploration process. And then once a person has gone through that self-exploration process and learned about different areas of their health that they might not have thought about before, then we want to equip them with the skills and the knowledge to begin to work on these areas. And so that we do in what we call our well-being programs. Now, this could be in a, quote-unquote well-being center that's, somewhere located on a facility campus, but it can also just be integrated throughout the various clinical and non-clinical programs across the system. So it could be a special well-being place, but it doesn't have to be. The focus really is equipping, like I said, veterans with the skills to be able to improve their health and well-being. And so this can include various educational offerings. It can include CIH approaches, things like stress reduction, yoga, Tai Chi, mindfulness, nutrition, health coaching to really help veterans take charge of their health. And then this is all done in connection with clinicians that are trained in this whole health approach that provides state-of-the-art clinical care, and it may incorporate CIH approaches, but again, done in this whole health approach where we really are focused on the person, what matters to them, what they want their health for, in the clinical realm, trying to get to some shared goals so that everybody's goals for health and well-being are achieved. And then this is all integrated with the personal health plan that the veteran owns, and so they are working maybe with a whole health partner, which is our peer role in the pathway to develop some of these goals as they begin to work on their health and well-being through these courses or with coaches. All of that's captured in the veteran's plan that the clinician can also view and give input into so that everybody's working to achieve the best health and well-being for the veteran. All right, next slide. So this is that same model with some of that language pulled out, but again, looking at empowering, equipping, and treating veterans in this whole health approach. These links here, the blue underline are hyperlinked, and it will take you to a variety of videos that we don't have time to watch today, but I wanted you all to have. They're out on YouTube, so you can look at. There's a couple of videos there that just will talk about whole health in general. And then the ones with the arrows there, a pathway to whole health, talks about what it looks like from a veteran's perspective to to receive these kinds of services, to participate in this self-exploration. There's a video on well-being you can see there, and then also the whole health clinical care. So I would encourage you to take a look at those if you have time in your busy schedules. Next slide. So the first diagram that I showed you really looked at the whole health system from a systems perspective. You know, how does a healthcare system operationalize this? How, you know, process-wise do we see this working? This diagram is what we use in our approach with veterans, and really talks about the whole health approach from their perspective, again, focusing on their mission, aspiration, purpose. You can see in the diagram that me, the person, the veteran, is in the center, and we really work with them on mindful awareness and cultivating that skill, and helping them to use that as they begin to think about how they can improve their health and well-being. Intentionally in this diagram, the green section, which are areas of self-care, is the biggest part of the diagram, because really that's where the biggest impact on a person's health and well-being can be, those areas that they work on. So we, again, we connect with the veteran, help them to think through what it is they want their health for. We introduce these areas you can see in these green circles, 8 areas of self-care that they might want to work on to improve their health and well-being. Maybe, you know, working your body, power the mind, spirit and soul, recharge, etc. And as the veteran learns about those different areas, then they begin to think about goals and action steps that they may want to work toward. All of that's in concert with professional care, which can include traditional as well as complementary approaches, and then in the larger context of the veteran and their community. So that's what whole health looks like from the veteran or the patient perspective. And then the next slide is, this is one of the videos that was on that previous slide, but I just wanted to call out, if you can't watch any of the other ones, this one is just a minute and a half. It's a great video. It's one of those that you know, they're drawing the picture while they're talking to you about what whole health is, and so in just a minute and a half, it will put into context kind of the whole health system and how this is working. So these things that I've just been describing, it will kind of succinctly pull it together in a minute and a half. So that's a great one to watch if you have time. All right, next slide. So I've been talking so far just about, you know, what whole health is, how we have conceptualized it, and now I'm going to talk really about operationalizing it. How are we bringing this to life in the VA? I'm sharing this slide. I don't want to cover all of the details on it, but really just to let you know that we have been working for many years with folks out in the field, learning, developing, evolving this model that's really brought us to where we are now. Really starting back in 2010 and earlier, there were many, many innovation grants across the VA, and then our Office of Patient-Centered Care and Cultural Transformation was stood up in 2011, and we, you know, began to really pick up momentum as we have worked toward this whole health focus. We had originally some centers of innovation, medical centers across the country that helped us to, you know, begin to conceptualize this. You can see in 2014 the centers of innovation and our grants really began to evolve to be the very beginnings of this whole health system, and that's when the Integrative Health Coordinating Center, which is a section of our office that Kavitha will talk about, when that was established. One of the big turning points for us was in 2016, which is when the CARA legislation was signed into law. And CARA stands for Comprehensive Addiction Recovery Act. And it's a really large bill, contains many different things, but there are a couple of sections in there that were very significant for us. And they directed the VA to really look at how we can expand the research and education on the delivery of CIH to veterans. So research and education was a focus, and then also it directed us to pilot how we could integrate CIH into existing services, particularly with a focus on pain and opiate use. And so that was really a driver to help us stand up what we call 18 whole health flagship facilities across the country. So the CARA legislation said, we want you to pilot this. The legislation actually directed VA to look at a pilot in 15 different sites across the country. However, the VA is divided up into 18 different networks of hospitals across the country, and so the leadership at VA said, let's not do 15, let's do 18, one in every one of those networks, so that we can really study and figure out how to operationalize this and then work toward implementing across the system. So in 2017, those flagship facilities were identified. I'll tell you a little bit more about who they are and what we've done with them in the coming slides. And that was, like I said, just a pretty significant turning point for us. The next slide, just wanted to emphasize that a lot of the things that I've been talking about so far are on the VHA level, remember the Veterans Health Administration level, but this is also a significant strategy for the Department of Veterans Affairs, so the big VA level. We're an element of the VA Strategic Plan that encompasses the next years through 2024. And so whole health is really, the bottom line, just a big priority, both for Veterans and Health Administration, as well as the VA as a whole. So really looking at how we operationalize this whole health system. If you go to the next slide, it's just a kind of a quick heat map, if you will, of the different whole health activities across VA through the years. It shows some of those early centers of innovation that I mentioned, some areas where we've had those innovation grants through the years, areas of education, some of our design sites, we call them, that really helped us refine this model. And then you can also see where the flagship sites are. Those are those sites directed by the CARA legislation. And then we're just about to launch into 36 additional sites that are really focused on a whole health implementation. And that will launch later this summer. So we're excited about that. So let me just loop back around and close out my section and talk to you a bit about the flagship facility. So if you go to the next slide, it will show you for each of our VISNs, we call them, and those are those networks, Veterans Integrated Service Networks. So those are regionally across the country, and there are 18, as I mentioned, even though the numbers go to 23. You'll see that some numbers are skipped here and there due to different consolidations through the years. But there are 18 sites that are really focused on full implementation of this whole health model. And Kavitha's is one of those in St. Louis, VISN 15 there. The pilot period, these sites were identified in fiscal year 2017, but their full pilot period started in our fiscal year 18. So it's a 3-year period, so 18, 19, and 20. So we're really just about halfway through the 3-year period of work with these sites. And if you go to the next slide, we in our office have worked really hard to help support them in their implementation efforts. And one of the key strategies that we've used for this is using the IHI's Learning Collaborative model. And so the first year and a half, 18 months of their startup, we've been using this Learning Collaborative process, and you can kind of see that's what this graphic is. It talks about how we progress through pre-work, virtual forums. We've had some face-to-face forums, and really building this community so that we can continue to learn from each other as we're in this implementation process. There's a lot of focus on these flagship sites because once we are at the end of our 3-year pilot period, there is a research project going on that I'll talk to you about, and of course a big report back to Congress on the successes, challenges, et cetera, that we discovered through implementation. So a big focus with this Learning Collaborative model. We've set up, online communities for these sites to communicate with each other. We continue to have monthly community of practice calls, and then we'll continue in this, last half of the 3 years to really focus in on areas of implementation that they may be having challenges with, so that we can get this fully implemented, hopefully, by the end of this 3-year process. We've supported them through a lot of other resources. We have a large variety of education courses, which I'll let you know about, implementation guide and resources. And then in our office, we're very fortunate to have a team of field-based consultants that work directly one-on-one with these sites, either virtually or in person, as they work through the implementation process. Next slide, please. So this one, I wanted to highlight some of the key cultural transformation strategies that we have pinpointed as really significant in helping us to move this forward. And, not that we've got this all figured out yet, but what we're learning as we go forward, we've really found that the peers have been essential in engaging veterans and, helping to build momentum with this approach. Like I said, when we first started to try to operationalize this, we, of course, as clinicians ourselves thought, let's do this in the clinic. Let's add this into the mix of all the other things that we're trying to do. And, not surprisingly, it didn't work. There was just too much burden on the clinicians as it was. And again, as we move forward, we found that that peer-to-peer engagement was critical in really having success. So we'll continue to focus on that. We have trained a lot of peers across the country, both internal to VA and some external. We're working with volunteers, we're working with veteran service organizations and others so that we can, YMCAs, so that we can offer this education, this peer-to-peer engagement about what whole health is to veterans wherever we may find them. Second critical piece really is that working with employees. Our employees really are our culture, and critical to let the employees, whether they're clinicians or not, experience a whole health approach personally. And once they have that personal connection with this way of thinking and this type of healthcare, then their their personal health and well-being improves. And they can talk to veterans about what this is and why they should think about this kind of healthcare approach. We just have some really early data, but we're showing that employees where whole health is implemented are having greater satisfaction, have less burnout, so less turnover, and we're really interested, as we move forward with our pilots, what else we'll see here. And then, of course, education has been critical in all of this, both employee as well as patient or veteran-facing education. To date, we've trained over 10,000 employees in whole health, and it's just a drop in the bucket. There are over 350,000 employees in the VA, and so it's a big task, but we are really committed to doing that. So we've got a strategy to really expand our faculty. Initially, we've been doing the bulk of this education through our office and with contractors, but really important to begin to train others in the field to take this and own it themselves and be able to train their colleagues and coworkers. Education for veterans, I've talked about some of that through my discussions, but a lot of our education happens in a group setting, face-to-face setting, and we also know that's not enough. And so we're working on how can we utilize telehealth to reach veterans that might not be able to come into a VA, or they may not have the resources at a local VA. We're also trying to expand our online resources, and we're working on building an app so that veterans who maybe don't ever come to the VA could still have access to this information. Okay, a couple quick more slides before I hand it over to Kavitha. I told you I'd say just a little bit more about our evaluation strategy. As part of this flagship effort, we are doing an evaluation, a partnered evaluation with an internal VA HSR&D group, and we're super excited. I don't think anything on this scale has been done before, and so we're eager to see what kind of patient health outcomes, patient-reported health outcomes we see, cost and utilization. How does this impact our readmission rates? How does this impact our primary care costs and utilization? And then what do we learn from the implementation from the site? So really excited about what we're going to find from the evaluation. Each of those flagship sites did get a bit of funding to hire a program evaluation assistant to help with some of the data collection. And you'll hear lots more about this in the months to come as we near the end of that 3-year mark. And then the last couple of slides are just a link so you have them to our education resources. I mentioned we've had a contractor that's helped us, the Pacific Institute for Research and Evaluation, as well as the University of Wisconsin, UW-Madison, have been key partners in developing and delivering a lot of our educational resources, both staff-facing and veteran-facing. So you can follow this link there. The next slide will show you just kind of a snippet of a page, if you click on there, about some of our staff-facing courses. And then my final slide then will just give you an idea of a variety of different courses that we have either active now or have done in the past. A lot of whole health for clinicians. How do you incorporate this into your practice? How do you incorporate this in your life? Again, for clinicians and non-clinicians. We have a whole health coaching program that's an accredited program and can lead to the certification examination process. There are some specialty courses, eating for whole health for pain and suffering, whole health for mental health, etc. And then again, lots of national as well as local faculty. So I know I went through that really quick. It's a lot of information, but I'm going to go ahead and hand it over to Kavitha and let her take it from here.
Thank you, Lori. That was a great overview of so much wonderful, activity that's happening within VA. So I will just check real quick that everybody can hear me okay.
Yes, thank you.
Okay, wonderful. So Laura did an amazing job of summarizing a lot of the strategy and drivers that are helping with this healthcare transformation. And so I'm going to spend a little bit of time drilling down into the specifics of how we are helping the field implement complementary and integrative health, which, as you heard Lori describe, is just a piece of this whole health system, but a very important piece. So in 2014, the Office of Patient-Centered Care and Cultural Transformation saw a need for an effort, a coordinated effort to help the field in implementing complementary and integrative health, not only implementing, but also helping with education and research across the system. So its two major functions are to identify and remove barriers to providing complementary and integrative health, but also to serve as a resource for clinical practices and education. And I would say that most often what we are asked for is information on how to deliver the care, how to get job descriptions for the care, and then to look at the data of delivery in that care. In addition, we help with responding to some of the congressional asks as it relates to complementary and integrative health. So we can go to the next slide. So what's interesting to look at, and I'm sure all of you out there listening can relate to many of the challenges on this list, is that we actually had a review of some of the barriers to implementing complementary and integrative health many years ago, and that was done by our partners in HSR&D that you see below. And they highlighted several issues that were standing in the way of more widespread dissemination of complementary and integrative health approaches. And these refer, when I say that, it refers to approaches that show evidence of promising potential benefit, especially within the VA, things like acupuncture, yoga, tai chi, meditation, biofeedback, and so on. And so what they noted were that there's a lot of difficulty hiring these practitioners because a lot of times it isn't an actual job description for them or a national standardization for how to hire these folks. In addition to that, there were problems with documenting how it was being done, especially if it was being delivered by a volunteer or maybe somebody in the community. A lot of times there wasn't funding dedicated to hiring these kinds of providers. As we know, a lot of funding is put into conventional care, but not necessarily adjunctive complementary care. A lot of times there wasn't enough space for group classes or supplies for the programs. And then when you try to rely on existing practitioners protecting their time to do this work is always a struggle. How do you balance productivity with trying to be innovative? And then, of course, having somebody who can actually coordinate these efforts was a huge issue. And obviously, as you've seen the growth over time, people are trying to dedicate program coordinators and managers to this work. You can go to the next slide. What's helping to drive the movement forward of complementary and integrative health is the directive that was passed in VA and signed in May of 2017. Again, this is another force, if you will, that was driving us forward in this work. And in this policy, it states that these types of approaches that show evidence of potential promising benefits should be a part of the medical benefits package for veterans. So we actually have a national advisory group made up of several different disciplines: mental health, social work, nursing, nutrition, just to name a few. And it's a very diverse group who comes together for the explicit need of vetting approaches to make sure that they meet this high level of evidence. And thus far, these are the 8 approaches that have been approved in VA, and again, must be delivered to a patient if it's a part of their care plan. Chiropractic is not under here, but it is covered under other policies, so it is a part of the medical benefits package as well. Next slide. And Lori did cover this legislation, so I will just dive in a little deeper on it because it definitely is a driver of a lot of the work that we're doing now, as Lori mentioned. In specific, it is asking us to look at the delivery of complementary and integrative health, and especially how it's integrated into the care of patients with mental health illnesses, substance abuse disorders, and chronic pain. So if you look at our VA population, that covers such a wide spread of our patient population. And so it's been really great, I can say from my own personal experience, to be able to deploy the whole health strategy across the system and then be able to look at who we're reaching. And indeed, the people with chronic pain, people with chronic mental health illness, those are the ones that are really gravitating towards this approach because it's very supportive, it's peer-driven, and they themselves can pick and choose which approaches they want to be a part of. So we're really excited to look at the outcomes that will come from this work, especially at the flagship site. Next slide. So I always think this slide is really interesting, and I hope you all do as well. We are really trying to look at the veteran demand for complementary and integrative health approaches. And we've obviously seen other surveys over time look at the delivery of these approaches and the widespread use. And a lot of times when you're trying to do this transformational work in the field, conventional providers will often come back and say, well, patients don't really want this. They don't really like this. They're not really interested. But this slide tells a different story. You have an N of 1,200 plus patients, and 52% use some type of approach in the past year. So it's definitely not a small percentage. And it's not surprising the ones that they're interested in are often the ones that have more maybe literature out there for them to read about, so massage, chiropractic, mindfulness. But it's really great to see that we're starting to see these percentages in yoga and relaxation and movement, Tai Chi, biofeedback. And so I feel like this slide is very striking to let us know that, yeah, indeed, our patients are interested in these approaches and actually have maybe used some of these in the past year. Next slide. And so to support that, again, as we think about doing transformational work, the question always comes up. Very honestly, people will say to me, well, there's no evidence for that, or the evidence is not high quality, so I'm not going to do that. Well, you know, it's really actually very interesting if you go in and do a research overview for yourself, that there is a lot of really good evidence, and there's a lot of high quality evidence that's emerging now. In fact, a lot of these approaches are in the ACP guidelines for chronic low back pain, and they have very high standards for putting those kind of recommendations in. And you can also look at research summaries that have been put out by VA HSR&D, so that's our research arm of the VA. And we have evidence maps for Tai Chi, mindfulness, acupuncture, one recently released for biofeedback, hypnosis, and guided imagery, also for massage. And so it's nice to be able to reference these resources. And again, these are available to all of you as well to look at. But I really, really love to stress that there's so much funding now being put towards looking at complementary and integrative health. And so that's been very exciting. Next slide. Okay, so I do want to spend a little bit of time talking about the business infrastructure, but promise not to get too in the weeds. So obviously, we all know that we want to deliver this care, but there really is no way to track this type of care. There are CPT codes put out by the AMA, and they are not specific for a lot of these approaches. We have acupuncture and biofeedback and hypnosis. We don't have yoga, tai chi, meditation. And so how do you track the actual delivery of these services to see if they're affecting outcomes? So VA had to get creative and come up with some internal ways to do that. Our own special 4-character codes, looking at the note titles that providers are putting in. And so I'm going to talk a little bit about that. You can go to the next slide. So in order to really get a way to track what we're doing, we knew that we needed to actually create job descriptions for these positions. You know, what do they look like? What do they do? What is their level in the facility? What is their level in the organization? And so we're happy to share anything that can be helpful to this group. We have created position descriptions for whole health partners. These are our veteran peers who help facilitate a lot of the self-exploration groups and classes, but they also do a lot of outreach to help bring people into this type of approach to care. We created position descriptions for yoga instructors and tai chi instructors, trying to use the best national standards that we could see. We also created a new position description for a health coach, and we have created new standards for employing acupuncturists and massage therapists as actual standalone professions within VA, which is extremely exciting. So we can hire directly for licensed acupuncturists and licensed massage therapists. And now we will begin work on yoga therapy. So again, if any of the content of these position descriptions is helpful in your own work, we're happy to share. Next slide. Okay, so what is so critically important in the whole health system is community. I think all of us know we can see our patients within a healthcare system, but it is literally only a small percentage of their life and their joy and their happiness outside of the healthcare system. So really engaging with the community is a huge piece of delivering these types of resources so that they can feel like they can do their own self-care in their own community, in their own home. Next slide. So to support those efforts, we have been looking at various methods to deploy complementary integrative health, and not just CIH, but also the facilitated groups and clinical care. So telehealth is a huge, huge part of VA culture and growing fast so that we can access our veterans who live in more remote regions or even share resources from one facility to another. For example, at the Flagship site, we're able to telehealth our Tai Chi over to Poplar Bluff, which is our more rural setting south of us, and that's very exciting. So here's a list of some of the things that we know are happening through telehealth. And if we go to the next slide, you know, while I'm describing these, you'll see some photos of Tai Chi being done through telehealth. So this is our facility just a couple hours away from us in Columbia, who Leslie is doing Tai Chi over to what are called community-based outpatient clinics. So they are out in a little bit further remote areas. And it's just so cool to be able to see on the camera who you're teaching, and it really does increase our capacity to deliver care. Next slide. In addition, we know that there are many people who can't make it in during the day, some people who can't make it in except on weekends, and so the ability to offer mobile apps and online tools is a huge, huge asset with VA. Right now you're seeing a screenshot of some of the apps. We actually have also online videos that have been vetted for Tai Chi and yoga. So we're able to connect with those veterans who would like to do this from home or maybe work during the day and want to do it in the evenings. So another great resource. Next slide. So here's an example of how we've vetted some resources. As you can see, it gets a little challenging, right? We know there's so much material out there. How do we know if it's done by a certified instructor who can do trauma-informed care. I saw that great question coming up in the chat box. How do we know it's safe for our patients? You know, how do we know they're actually learning self-care? And so we've had our subject matter experts go through so many different online tools that we've seen. We've contacted organizations that we know are friendly to veterans and get a lot of training in trauma-informed care, and really tried to find resources that we know can be trusted. And so that's what you see here. And again, happy to share what we've gone through and deemed as appropriate for our veterans. Next slide. Okay, also wanted to share with you all that you might have heard of Mission Act. It is rolling out throughout VA. It's a very large piece of legislation as well, and there is a big portion of it that focuses on revamping our ability to offer care in the community. So I wanted to let this group know that indeed complementary and integrative health, as I mentioned, is a part of the medical benefits package, and so it also can be offered in the community. Right now that network of providers is being developed by the contractor, and it will include what I have listed there before. A standard episode of CARA allows us to say the exact number of visits we would authorize in the field and how often we would reauthorize. So we have created all of those, and they are now available, and as the community care contract rolls out throughout the country, those will be a part of it. I know many VAs are trying to deliver this care within VA to keep it comprehensive, but when we're not able to do that, the ability to offer in a veterans community is going to be really important. Next slide. Okay, so I am rounding out my section of the talk, and you know, we went through so much information on this presentation, so it could be a bit overwhelming. So we wanted to leave you at least with a comprehensive resource slide that you can all access. So there is the main web page for Whole Health, and then the online tools that I mentioned. The multimedia, I was actually just in that last night to prepare a different presentation, and the videos are phenomenal if you're wanting to take a look. The evidence maps and some other research articles are there, including the Whole Health Library. And of course, if there are any questions related to the Integrative Health Coordinating Center, you can certainly reach out to us as well. And I think that's it. We'll go to the next slide just to make sure. That is it. Thank you very much for your attention.
Wow. Well, thank you both of you for such tremendous presentation. We have questions, so I'm just going to jump right into that and ask, for those of you who still have questions that you haven't put in yet, if you could use the chat, that would be great. Right now, I am looking at one that came up on the questions panel and did not yet make it to the chat, but I can see it here. The VA hiring process can be a bit challenging. Are there specific titles to use for any of the jobs that may be available for the Whole Health Initiative and specifically the CIH program? That's from MK Brennan.
I can jump in to try to answer that one. And of course, Lori, please feel free to add. And I agree. Sometimes we're held to using the actual name on the position description. So rather than saying yoga instructor or Tai Chi instructor, the actual position description is under is recreation assistant. Likewise, for some of our health coaches, it's under social sciences instead of health coach. So if that's what the question is referring to, I'd be happy to give you the actual name. We try to tell the field to put whole health in parentheses, but you are right, it can be a little challenging to find them. All the jobs are posted on USA Jobs for hiring. But for this attendee, I'm happy to have that person connected with me and we can give a bit more information.
Thank you. MK, I just unmuted you, so if you have anything brief that you need any clarification on, this will be your chance, and then I'll go to the next question.
No, that was helpful,
Okay,
as
great.
I know that others may be interested in that as well.
Thank you. All right, let me go back to the chat and see if anything has come up on the chat. Okay, nothing still on the chat, so I will go back to the questions. Oh, yes?
It might be worth mentioning, Beth, I know this is in the chat box, but the question did come up, will the slides be made available? And the answer to that is yes, they will be posted on the ACIH website. So hopefully, if you have any trouble finding them, either myself or Beth would be able to help you direct you to that, but they will be available, which is
Yes.
wonderful. Thank you for
Thank
making
you.
those available.
Thank you.
Yeah.
Thank you for making the slides available. Thank you, Dale, for saying that. And it will probably be next week, and I'll send something out on where you can find it. We have a question from Bo Anderson. In conversations with various people, I find that many are not aware of all this excellent work that the VA has undertaken with implementing CIH. What are you doing to get the word out? This is such a good example for others to follow.
Well, this is Laurie, and I'll start. And yeah, we we know that it's difficult for us to do outreach, and sometimes difficult to change the conversation in the media. But there are a lot of, particularly at the flagship sites, but really sites across the country where they are connecting with local media, getting stories out. That way, we have, of course, social media presence, et cetera, et cetera. We really are working to have partnerships out in the community, both with veteran service organizations or just other organizations such as YMCA, Red Cross, other community partners. Kavitha mentioned the whole health partner role. A bit of what they do in their job is related to outreach. So that's a lot of local things. We're also working on a few national campaigns, public service announcements, et cetera. But yeah, it is just tough to get the word out there. So I don't know, any ideas you have are definitely welcome. And then Kavitha, would you add anything to that?
Oh, I just echo that, Lori. I really, as a flagship, did not even really appreciate how much effort needs to go into communication. You know, you always think word of mouth will help you. So we've been really trying to look at radio and TV spots and articles, and we actually just hired a communication director specifically for our whole health system to assist us in getting the word out. So it is a challenge.
And maybe we can talk after this and get some ideas from our working group members and working collaborative staff and board about how we might be able to help get some of the word out to our communities. It really is great, and this is a wonderful start. Question from Beth Howlett. Would love it if you could share the acupuncture standards when you share the slides. So I have the slides and I'll share those, but if either of you could send me the acupuncture standards, I will send those out as well. And Beth, thanks you for a great presentation. So thanks for that comment, Beth.
I'd love to see the massage ones as well while you're at it, and I'm happy to request those separately. But
that'd be great.
Yeah.
Good.
Thank you.
Wonderful.
Definitely, not a problem.
Thank you. And here's a question. Can acupuncturists offer biofeedback, neurofeedback to VA CCN patients? Would that have to be approved separately from acupuncture treatment? That's from Anka Marineska.
Could you repeat that one more time for me? But I just was breaking up a bit on my end.
I realize that's kind of a detailed and long one. I'm going to send you that one by email. So Anka will get that reply to you by email. But here's one that's a little bit more direct. Are all of the standards available offline? That's from Melissa Armstrong.
Yeah, that's a great question. I was just thinking that. I mean, usually with published documents for the VA, they usually are, but I'm not sure if the actual functional statements are, so we'll be happy to share. It is a good question. Sometimes you can do a simple Google search like of the policy directive for CIH and you will find it, but I'm not sure for functional statements.
We'll see if we can follow that up in email too. Thank you. Thank you for all you're doing. How would I get access to the job descriptions? And this one is specifically for massage therapy. Is that online, or is that something we should work on offline?
So the job description would be what we call it a functional statement when it's for clinicians like a massage therapist. So additionally, we will send you that. Maybe if you just send me an email with the ones you're looking to see, then we can send you the access.
Okay, I'll go through these questions and try to hone them down so that would be very helpful. Where can we find information about the various certification programs?
And is that for health coaching or for yoga, Tai Chi?
Doesn't say, so perhaps I don't
I'll
know.
do more of a general answer then. So for health coaching, actually for all of the certifications, we don't create our own internal standards for that. So health coaching is the National Board of Health and Wellness Coaching. Yoga is RYT. And then Tai Chi, generally we're looking for the American Tai Chi Qigong Association or something equivalent. So we go with national standards outside of VA. Nothing that we create internally.
Well, that's very helpful. Great. Well, I, for one, can't wait to listen to this whole presentation again for all the information to be gleaned from it. We thank our presenters so much and all of our attendees for your wonderful questions. And Dale, may I ask you to sort of send us out here? Oh, wait, before I do that, there is one more thing I wanted to show on our end, if I can, there we go, get back to, I just wanted to mention before we sign off that we do have our next working group meeting is in September 11th. We're having whole systems research JACM review with Nadine Ijaz. And then next Thursday, we have a special webinar about a study that was done in interprofessional collaboration among complementary and integrative health providers, challenges, facilitators, and suggestions for improvement. So I wanted to make sure you all saw that. And now, Dale, if I turn it over to you to send us out with a big thank you.
All right, I'll do it. Thank you so much. First of all, to our presenters, Kavita and Lori, we really, really, really appreciate you sharing all that that great information with you, and for sharing the slides especially. I imagine folks will be able to will be motivated to go back and take a look and follow the links and see what resources they can get to improve the work that they're doing in their circles. And also, thank you to all of our attendees for listening in today and for spending the hour with us. And we look forward to connecting with all of you again at our next next working group meeting. So have a great afternoon, everybody.
Thank you all, and the question came up about registration for next week's webinar. Please go to the Academic Collaborative for Integrative Health website. All the information is there. So thanks again. This will be posted hopefully next week. And thank you again, Lori and Kavita. Really appreciate it.
Yeah, thank you.
Thank you.
Take care.
For having us.
Bye-bye.
Bye-bye.